Hello everyone, welcome to this new video from us, Tejas.
Hello, I am Tejas Ghetia from India. I'm working here in psychiatry in Ansbach. Yeah,
Okay, in Germany, of course.
yeah, of course in Germany. I'm doing my residency since last 7 months.
My name is Jameel. I come from Jordan. I'm 28 year old and I've been here in Germany since about 2 years. I'm doing currently internal medicine, 6 months. Before that, I was in psychiatry doing a psychiatry residency for 21 months. I've done here in Germany a total of 21 months of residency in psychiatry, and then psychiatry, not psychiatry, and so on and so forth. I changed to neurology, and now I am internal medicine. Probably I will go back to psychiatry, whatever my situation is. I thought, based on my experience, the experience of Tejas, 6 months, where you said how much? 6 months.
6 months, yeah.
So we are talking about, we'll be talking about the residency of psychiatry here in Germany. As you see, we are foreign doctors. So we are talking specifically about the experience of foreign doctors here in Germany doing this residency. It is about requirements, difficulties, advantages, disadvantages, if we recommend that, do not recommend that, and similar topics. So if you are interested in this thing, you might like to watch this video. Okay, Tejas? Let's start. Okay, psychiatry in Germany. The first question that in this video will not be trying to explain psychiatry, yes or no, because I think this is a great discussion with the parents, with the family, with the society, with the colleagues. Why are you psychiatrists? Why not?
Yeah, that we will not discuss. Yeah, thank God.
So,
or if there is one.
so let's say someone is have already decided that he's going to be a psychiatrist, and that he is in Germany. He's doing that in Germany. So what are the advantages, disadvantages, prerequisites, and similar things? So prerequisites, like I hear that a lot. You are doing psychiatry, or you want to do psychiatry in Germany. The language. How could you understand that? You are in a new culture, new language, new mentalities. How could you understand it? How could you understand the personality of the patient? How could you help him? You are a foreigner. How you could do that? It's not told to us from Germans. Ironically for me, it was told more from foreigners as from Germans. So what would you say? Why psychiatry? This is important to mention. If you met people who, I talk a lot, yeah. If you met people who are doing psychiatry residency here in Germany, most people who come here, I think they are not few. They start residency in psychiatry. Why? It's not that they love psychiatry, but because they
do not get a job in their own in the branch they want, and then start with psychiatry, and then they change it within 6 months, and so that they have somewhat experience. They can also know about the medical healthcare system in Germany, and also they can understand what they should do next.
So their dream
Most
is
of
to
the
be
people-
neurosurgeons or to be surgeons, and they end up doing psychiatry. So
I have met many people, such people.
Yeah.
Have you?
Yeah, I think so. Maybe I am one of them right now, because I'm no longer a psychiatry.
I don't think you are. I think you at first you wanted to work in psychiatry, oh?
Right. So I mean, some people go to psychiatry from the first. It's not that you assume that all people in foreign doctors in Germany who are doing psychiatry are doing it because they like it. Actually, their goal is neurosurgery, for example, and because the language is not very good, because neurosurgery is very competitive, residency positions are not many, so they begin in psychiatry. Psychiatry easy to get this.
And also it is a requirement to complete neurology, you can say.
Right. Thank you very much. This is an important topic as well. An important point. If you are to be a neurologist in Germany, then you need to do at least 1 year of psychiatry. legally 1 year to train in a psychiatric hospital in order to be a neurologist. And I think if you did psychiatry, you could get 6 months of them recognized if you are going to be an internist or if you are going to be a family. I do not know, but for neurology, at least 1 year. But I think it would be recognized.
I think I can post the links, the requirement, but it will be in German. I can post the links from Nordrhein-Westfalen. They have posted all the curriculum for Facharztausbildung. How many?
Nordrhein-Westfalen, there are 5.
I think it is from Cologne or Düsseldorf. I'm not sure. I'm not sure.
So, for those who do not know a lot about the medical license authorities in Germany, there are 17 German states. However, there are 23 or 24 medical license authorities, and in each one of them there are separate rules, requirements for getting the medical license or for doing the residency. So the requirements differ from one state to another, but generally 90%, 80%, maybe 95% of the things are common. Okay? So in one of these chambers of doctors, Ärztekammer, medical associations, medical councils maybe.
Yeah, it is a different word for in each and every country.
Okay. Yeah, so medical association, so on and so forth. They have like requirements, a lookbook. It is called a lookbook for what need to be done in order to be a psychiatrist, to be a neurologist, neurosurgeon, and such. Like in surgery, for example, you need to do like 100 appendectomies, 50 cholecystectomies, 100. I don't know what kind of operations. For psychiatrists, there are also requirements like attending 50 hours of psychopharmacology, 30 hours of presentation.
How many hours of case presentations or psychotherapy?
Right, psychotherapy.
Or how many hours have you spent in OPD with patients? How many hours in ward, in different wards?
Right, so
all the requirements. Also, you require 1 year of neurology, and
1 year to be a psychiatrist. You need to finish 1 year of neurology. This is important. 4 years of psychiatry. So. I'm sorry, we are doing that relatively new, so a lot of digressions. Digressions is the word. So we talk maybe in details about some subtopics. So we will go to the main topic right now. So requirements on the psychiatry, in the requirements for the psychiatry in Germany. So the total period of training is 5 years. 4 years psychiatry, 1 year at least internal medicine in the doctor's chamber in Munster, where I was a member. You could do 1 year neurology, a must, 3.5 years psychiatry, and 6 months maximally. You could do internal medicine, neurosurgery, neuropathology, or
child psychiatry also. No. It was. It is there in Nordrhein-Westfalen. It is there. I had
child psychiatry. And the psychosomatics too. So details are not very clear, but totally 4 years, 3.5 years, and 6 years, 6 months like internal medicine. And this is very important. So these are the duration of the residency. Do you need as a foreign doctor? Is it so hard to get in the specialty? It is there are many positions. Why many positions? Psychiatry here is like well established. There are many psychiatric hospitals, many beds for psychiatry, and therefore many psychiatrists. In Germany, I think there are more than 12,500 psychiatrists. Germany has like 81 million people. I come from Jordan. The population of my country is about 6-7 million. Jordan statistics of 2013-14, there are 60 psychiatrists. It's like per 1,000 person there is one psychiatrist. In Germany, the percentage is more. If we applied the percentage of psychiatrists in Jordan to Germany, then instead of 12,500 psychiatrists in Germany, there would be only 600 psychiatrists. So you could understand the difference. Many beds for psychiatric hospitals. In the hospital where I worked, for example, we had 360 beds for a region, that attachment area or Einzugsgebiet for a region of consisting having a population of 240,000 people. So there were 360 beds of psychiatry. So you can imagine the number of beds of psychiatry. So there is a demand for this specialty. Like all over in the world, you need to accept that psychiatry is one of the not popular specialties. You need to
one of the developing branch, one can say. Yeah.
Developing, not developing. This is another topic, but it is one of the least pop. And there are studies.
That is list. That is the least popular branch, you can say.
Not least popular.
One of the less popular.
One of the least popular, like rehabilitative medicine or family physician or family physician. Maybe in Germany it's more popular. Yeah. So you could getting a position if you are a foreigner. Is it hard to get a position then? Some people would say you are a foreigner, the language and so on and so forth. Is it hard? Did you notice it is hard to get as a foreigner?
As a foreigner?
With German as a second language.
Okay.
Please.
If you have B2 level or C1 level, it doesn't matter, but the requirement is that you can speak and communicate with patients. That is the basic requirement they check during the interviews. So I had given in psychiatry 2 or 3 interviews, and almost always they asked me the different questions about my life and where I have learned the language and something like that. But they wanted to know my language level. That is the first point. So the language is the basic requirement, I can say, and your medical knowledge is not that much asked in interviews. So I think psychiatry is not that much difficult branch, because there are many vacancies available and not many people want to work in psychiatry. And so like internal medicine, psychiatry, they in Germany, in internal medicine and in psychiatry, there are compared to other branches, there are many vacancies available in these two branches. So if you go on the internet and search for residencies, then you can find the psychiatry and internal medicine most often compared to
neurology, geriatry,
neurology, geriatry.
Many positions. The population in Germany here is becoming older. It's like 2035. I read this in one train station. Sometimes we read interesting information in train stations. Like 2035, 35 in 2050. Maybe it's like 35% of the population will be more than 60 years in Germany. In comparison, like in a country like Egypt, more than 90 million people, like 35% of the people are younger than 15 years. So there is a demand. Psychiatry, neurology, internal medicine, geriatrics. I'm sorry. You mentioned the point that the basic requirement, the most important requirement is the language. So do I need to have C1 or C2 level, or in other words, for those of you not familiar with the terminology, do I need to speak perfect German in order to get?
Not the perfect German, like I said, the more is like communication is required, that you can communicate with patients.
Right.
You can understand without asking again that what have you spoken or what did you say, or you do not have to speak twice so that patient understand. That is the first requirement, you can say. You do not have to speak again the same sentence, and patient does not require to speak again.
So let me formulate that. Thank you. Good answer. Interesting. Let me formulate the question in another way. Another way. Compared to an internist or a resident in surgery, do you need, as a psychiatrist, so particular knowledge of the German language?
No, I don't think so. But not at the start. You can of course, compared to internist or surgeon, you have a more to deal with the language in psychiatry, because you are always speaking with patients and communicating with other people, and also writing too many documents.
I need a little pause. There's a very
but what I'm trying to say is that if at the start you do not require the different level of language, if you have B2 level or C1 level requirement, then you can receive the job. It is not that you should be perfect in the German language. That's what I mean.
The language is very important in psychiatry. Right. There's a beautiful German sentence about this, and es besagt, das Zitat besagt, die Sprache ist das Skalpell des Psychiaters. the language in English, the language is the scalpel of the psychiatrist. Scalpel, what the surgeons use, psychiatrists use their tongue, the language, so it is your scalpel. So the language is very important. This is almost always asked in the groups. As a psychiatrist, do I need to perfect? It's not. No one is requiring you to speak perfect, but like it is. Do I need to speak like C1, C2 to speak?
I don't think so. No.
To be accepted there? Are the people who are accepted in psychiatry, if you met 100 people who were accepted in psychiatry in Germany, foreign doctors, or doctors with German as a foreign language, and 100 doctors with German as a foreign language who were accepted in surgery, do you accept that the psychiatrists speak better German than those?
No. I think they speak the same level.
Same level, maybe for the psychiatrists a little bit better for the candidates. They search for that.
Yeah.
But based on my experience, people when you say psychiatry, they always connect psychiatry with psychotherapy. So if they think if you are accepted in a residency for psychiatry starting from day one, you will be doing psychotherapy.
Yeah, I heard that question often. If you say that you are a psychiatrist, then can you read my mind? If you are just suppose before a few weeks I was traveling in a train and I met one person and he asked me, or we were just talking, and I told him that I'm working.
A German.
He was a German, and I told him that I'm working in psychiatry, and he told me that you are a doctor and working in psychiatry, then you can read my mind. No, I cannot, because it is a different process, it is totally different questions. We are just talking.
This is another.
It is a different topic, but what I am trying to say and what I am trying to communicate with other people, that it is not like that you have to do a psychotherapy. Psychotherapy, it is a totally different process, and it is done around after. You do not receive a word also with psychotherapy mostly, because they are given to if you have 2 years or 3 years experience. After that they give the psychotherapy words, so that you know a little bit more information about.
Thank you. So psychotherapy is not a must. From at the beginning, like you do it, like you have 4 years in psychiatry, you could do it in 3rd or 4th year. It's not a lot of work, and psychiatry is not about psychotherapy. Here in Germany, it's very important. You will be a specialist for psychiatry and psychotherapy. In the USA, you are not required to do a psychotherapy, to learn psychotherapy. In Jordan, too not. In India, I don't think so. You are always here in Germany. The situation is so, and you need to accept it or leave it. Leave the specialty. So in Germany, if you want to be a psychiatrist, you must do psychotherapy, or at least you must do the training in your.
It is 6 months or something like that.
Or 1 year, or
1 year,
like something like this, and you could survive in the psychotherapy. Like I'm not a fan of psychotherapy. This is why I'm talking about this point. So psychotherapy psychiatry is not about psychotherapy. There are like addiction medicine. Addiction medicine is like people with addictions like alcohol, drugs.
Yeah. I am working on addiction ward, on the alcohol ward, and you just admit the patients like internal medicine. You ask the questions, the basic questions. It is like a format, the anamnesis or the history taking. You take the history. Do the
easy questions. Not complicated.
Not
how much do you drink?
How many times per week, and did you have other complications or problems and. Like
not complicated. Allgemein psychiatry, general psychiatry, like schizophrenia patients, acute wards. Also, what happened is like most of the time, some patients of them they came like psychiatrists, like a judged order that they stay, will be forced to stay in psychiatric hospitals. What did happen? Why did you threaten your neighbor? What did you take as a medication? Other cases like suicidal patients, people who have tried to kill themselves, took medications. This is most often format worldwide, and what I saw here in my experience, they come as Überweisung, as from other hospitals, like
from their family doctor. They write down a prescription, that they require.
Prescription for medications.
You can say advice.
admission.
Yeah, admission form or I don't know. Also
Okay, so this is the thing.
Überweisung is the word.
So maybe we'll make a little advertisement. We made a video about advantages and disadvantages of doing a medical specialty in Germany, specialization in Germany, and we talked about the point of the language and learning medicine in another language than English. So this is the point, like Überweisung, a patient come from another hospital, and this basic word we do not know it, and in English, because we know it in German, but not in English. So patients, small history you will take, other patients like other cases like bipolar disorder, geriatrics, old patients with dementia who come because of delirium, because they are hard to be controlled in the Pflegeheim, in the seniors houses where they are living. So psychiatry is not about psychotherapy, and to be successful at these like geriatrics, gerontopsychiatry, most of the time you are not doing psychotherapy. Like
it will be like internal medicine, you can say.
Because
it will be with so many comorbidities like diabetes and hypertension, and you will be treating them.
And aggressivity or the delirium symptomatic, you will be treating that. So, and psychotherapy with dementia patient does not work. No, I was one time in a Bellentgruppe in a seminar, and it was a patient. It was about a patient who has dementia, and the resident doctor said the treatment for him is psychotherapy. So some people, then she did not think about it, most probably. So it's like the language will never be a barrier. If you think my German is not very good, it's very hard to come into psychiatry. I need to do psychotherapy. I think this is it's not a huge reason to be afraid about regarding this point, because there are many things to do other than psychotherapy. And psychotherapy, like I said, you do it. It's like surgeries, like surgeons in residency surgeries, they do not do a heart surgery starting from their first year or second year, or they do not do an operation for the trigeminal nerve in first year. Even they finish their residencies, maybe the neurosurgeons, and they could not do such an operation, for example. And the same, if I am to use the same analogy for psychiatry, you do not need to do psychotherapy starting from your first years in it. So psychotherapy, prerequisites, as we talked a little bit, there are certain courses and seminars that you need to attend. The cost is between 10, I read one time, and I think these are the cost, around 10,000 euros. But the good news, you do not pay for that. The hospital where you are working, in most of the cases, like 90% of the hospitals, they pay for your the cost of your training. Like I said, for 50 hours psychopharmacology courses, lectures for at least 50 hours in one clinic in Dortmund, for example. They take 25 euros for each 2 hours of lectures. 50 hours, 25 hours, like 25 multiplied by 25 is 625 euros. Some Balint group, self-experience group, this is one thing that you need to do here as a psychiatrist. You need to attend 75 Doppelstunden. It's like 150 hours of self-experience group where you will be talking about yourself, about your past, about your problems. You are not forced to do that, but you are encouraged to do that, and you shall do that. And then this thing will be discussed. Like 10 hours costs 200 euros. So you are requested to do 15 of these 200 euros things. So it's about 3,000 euros. And there are for Tiefenpsychologie, deep psychology, Tiefenpsychologie, or Verhaltenstherapie. This costs, maybe I am attending a course like next May, it costs 700 something. And then this time I'll be paying myself for that, because I'm no longer in a psychiatric hospital. So the costs are a little bit high compared with other specialties. And other specialties, yeah, there are costs to like to be an emergency doctor. You need to attend a course that for a week that costs maybe 800 1,000 euros in this range. So in psychiatry, you need to pay for the courses, for the seminars, but it's not that you the hospital pays for you.
You mean these courses means Fortbildung and
Fortbildung.
Okay.
Eigentlich Weiterbildung, Bausteine,
Okay.
sagt man.
Okay.
Cornerstones. You need to fill a logbook, like surgeons fill operations, and you need to fill that. Otherwise, like in the residency, it's not very hard to get in 5 years. The language, you can always ask, what did you mean, what I did not understand it. There are always nurses there with you, they will help you certainly, and help you during the work. As a foreigner, I've never experienced any kind of discrimination, because I thought I am a foreigner, maybe a psychiatric patient, or have you ever, you will not never mention that. But I can assure you, so this should not be no fear of you, that at least I work north in the near Dortmund. I've never felt discriminated against. Maybe one time, 2 times, I was one person did not want to talk with me. Otherwise, in the gerontopsychiatry, geriatrics, some patients will insult you. But not only you will be insulted, all of the people in the world.
Yeah, of course.
Yeah.
But that is not because you are Auslander or you are a foreigner.
Right.
It is like because of the
dementia, because he's psychiatric,
because
so
of the
this is the thing
disease,
that I do not like, because of the disease, right? But some people do that like they are determined, and they insult the sisters and the nurses, and they doing that. I once one person told me in Holland, this is not allowed for the patient or something like that. Anyways, so if we are to discuss that, we are discussing advantages or disadvantages of psychiatry. But dangerous it is not, because for you as a foreigner here in Germany, it's not particularly dangerous, or not dangerous like you or any other German. This was my experience, but I cannot generalize that. If you psychiatry, what would help you here in Germany, if you know a foreign language, based on my experience, North Rhine-Westphalia, near Dortmund, Bochum, Essen, Düsseldorf, Arabic, maybe Arabic is not that much, Polish, Arabic, Russian, French, because of African immigrants, Arabic refugees and immigrants from North Africa, from Egypt. Russian, some people from Russia, but it was not that much. Most of the translation that we needed was for people from Arabic countries, French, Africans, Albanians, Greek, few, and there are many Greeks here in Germany. So this is very important. If you have a foreign language, this is very important for you and for your application. This will help a lot, because if the doctors could not talk with the patient, they could not diagnose anything. It's like in internal medicine or in surgery. So the language is an important thing. If you know a foreign language, and of course how good your German is. The advantage is that you start in psychiatry. If you are not decided upon if you are going to be a psychiatrist, begin in psychiatry. You will improve your German language dramatically, because you are speaking the most of the time. On the other side, you are not learning a lot of medicine, because here in Germany the system is, if you are having a patient who have uncontrolled blood pressure values, or uncontrolled blood sugar levels, or he's complaining about ear pain, he is having a discharge from his eyes, then consultation, you send him to a nearby hospital where there are internists, where there is an ophthalmologist, or the internist will come to the hospital and he will see them. So this is not your responsibility. I once told a colleague of mine, he wanted to be a psychiatrist. I told him, I'm not learning medicine here in Germany, in psychiatry, everything, we send them consultation. We do not treat them ourselves. Other people do that, other specialties. And he told me, it was a beautiful answer. Also for example, an ENT specialist or a neurosurgeon, if he has an aggressive patient, or has a patient who has hallucinations, he will not treat him himself. He will consult us. And it is the same thing. If you are having a person a patient with certain easy, like a small wound, do you treat that? Do you
Normally, the small wounds probably, but if there is a fracture, if
no,
there is a
small wound, like you need two or three stitches. You do that to the surgeon?
normally not.
Normally not. In my hospital, the same. Normally not. You'll send it to another hospital. You do not have time if you are doing night work alone. You are in a hospital like 360 beds, and at 12 p.m. you are responsible for 360 doctors. The only hospital, the doctor in the hospital do not have to sew stitches, and being responsible for 360 plus patients in the night in a psychiatric hospital is not that difficult if you are a good doctor. And lifestyle is very good in psychiatry. It is compared with other specialties here in Germany. You do not work as many hours. Life conditions are much better because they are searching for doctors. So the hospital are trying to make the situation friendly for them. And you get the same salary in Germany if you are a surgeon or you are a psychiatrist. Most of the time, as residents at least, you get the same salary. After that, I think it's the same. So you'll in psychiatry you are sitting most of the time. You do not have to learn a lot of the time. So if you have other hobbies, it would be perfect for you to be a psychiatrist because there is not a lot of medical knowledge to make you a safe doctor. And what else could we talk about before we end this?
One disadvantage I would like to say.
Please.
Yeah, that you have so many documents to communicate with the jurists, or what we can say, with the legal system and judges, and that's why you must learn some legal words, but that is not a prerequisite that you can learn along with time. So
if you are in psychiatry, you need to improve your German.
Yeah.
Again, I saw people who do not speak very good German, and they are doing that 3-4 years. It's not very good, but of course these people will not be famous or good psychiatrists. Did we forget something? A disadvantage?
If somebody is unsure about psychiatry or neurology, one can directly work in psychiatry, like we told, because psychiatry is of course required for neurology also.
Right, so you could try it.
Yeah, you could try it. And if you are unsure about any branch, there is always a possibility to take a hospitation or observership for training period for 1 month or for 3 months.
And this is the most important thing here in Germany. If you start in psychiatry, you can always change the specialty. Right. So it's not if you like in the USA match process and these complicated things. You begin this month. After 2-3 months, you say I do not want to remain here. In most contracts, you have a period of 2 weeks. After 2 weeks, you could say goodbye, choose, ciao. You can change the hospital. So if you are not sure, try it until you know if you like it or not. And
after 1 year, 2 years, whenever you decide that now I do not want to work in psychiatry, you can always break the contract and again work in other.
And as we said, 1 year would be recognized if you are deciding to become a neurologist. 6 months, most probably, if you are deciding to be an internal medicine or a family physician. Surgeon, I don't think so. So this was it about psychiatry in Germany. I think the video should be longer than that, but we need to do something right now. And I do not have any other ideas to talk about. Do you have?
No, I don't have.
Okay, so thank you for watching. If you have any questions, you could post them down in the comments section. And take care. Thank you.
Thank you.
Just.